Good evening, all. This is Sophia Ahmed. I am the founder of Talo Care, and we are here today to gather to learn a little bit more about mental health. So today's subject is mental health and cultural impact. This classes is funded by American Rescue Plan Act through the city of Brooklyn Park. So if you do live in Brooklyn Park, please put the zip code in the chat. Thank you very much. And it will be hosted by Nate Hurst. He's a licensed social worker and also licensed alcohol drug counselor. This is a partnership with Global Fatherhood, Sam Marbury, and I will give the floor now to Sam to introduce him a little bit about himself.
Thank you so much, Sophia. My name's Samuel Mwangi. I'm the Executive Director of the Global Fatherhood Foundation. And again, welcome to the Mental Health Community Workshop. We have two powerful people in the forum today. We'll be talking about our mental health and how it impacts our community. I know Nate is here. Faith Zapit here, I think is a medical practitioner. She is in the house. So Sophia, go ahead and start the program. Then I think we'll move on, and I have people coming.
We will start with a small presentation with Nate Hurst, and then if anybody has questions, please put them on the chat, and we will give a short notice for question and answers. Go ahead, Nate. It's your
Good evening, everybody. As Sophia says, my name is Nate Hurst. I'm licensed independent clinical social worker. I licensed alcohol and drug counselor. I have just a minute. Okay. I sent Sophia another PowerPoint, but I came up with this one recently, and just to demonstrate how culture can impact mental health. We're talking about 4 ways to do this. You know, the first one is cultural stigma. Every culture has a different way of looking at mental health. For many, there is a growing stigma around mental health, and mental health challenges are considered a weakness and something to hide. This can make it harder for those struggling to talk openly and ask for help. Just a little backstory. You're looking at this goes throughout, and this is very strong. This cultural stigma is very strong in the, as they say, the BIPOC community or the people of color community, regardless of where you might have come from. Africa, South America, different places that this thing about mental health is very held in a very close and tight way of thinking. Cultural stigma. And I've told this story before. Growing up, I mentioned to my mother I was depressed, and she started asking me a group of questions. And the first one was, do you have a mortgage? I said, no. A car note? No. Electric bill? No. Then she says, what do you have to be depressed about? So right there, then it's saying, you don't have to be depressed. And we, at some point, we don't look at our children being depressed, our teenagers, or we don't see people when they're depressed because we don't want to acknowledge it. It all says number 1, like I said, I'm not good at making slides. Understanding symptoms. Culture can influence how people describe and feel about their symptoms. So when you ask someone how they feel on a daily basis, they'll say, all right, or fine. They may never describe that I'm not getting rest. I don't eat as much. Symptoms of depression. I don't care much about what's going on. I don't interact with my family that much, or I stay in the house. I don't talk to other people in the community. And I do assessments, and sometimes you hear that. Those are the descriptions of one to look at depression. Or I get very nervous in a crowd. I feel anxious all the time, which is some some of the symptoms of anxiety. It can affect whether someone chooses to recognize and talk about only physical symptoms. Only emotional symptoms or both. You don't want to describe people of fear. If I tell somebody that I'm feeling this way, they're going to think I'm, to use the term, crazy. I was having a discussion, and I want everybody to think about this. When you hear the word mental health and also trauma, but we'll start with mental health, what is the first thought that you have when you hear someone talk about they may have mental health issues, depression, anxiety, bipolar? What do you first think? And we can come, after I do this one, we can ask what people think about that. We'll skip this. Come on, excuse me. The third one is community support. Cultural factors can determine how much support someone gets from their family and community when it comes to mental health. Because of the existing stigma, minorities are sometimes left behind, left to find mental health treatment and support alone. So just to say, the first time I went to therapy, I didn't think I needed to go. And I definitely wanted to go to complain about who was my first wife. What I discovered in therapy, I began to talk more about me and what I was feeling, how I was looking at things. Didn't talk much about my ex-wife. I began to look at myself. I had a pretty good therapist. So when we talk about community support, and fortunately, the gentleman that mentioned mental health or therapy to me, my first response was, I don't need it. Nothing's wrong with me. But being in recovery, one of my mindsets I had taken in life was, well, I can try it, because what else I was doing was not working. Self-medication was not working. So I felt that therapy, I'd give it a try. If it didn't work, then I could move on. Let's go back to that question. What is it like when someone mentions they have mental health problems to anyone that's currently on Zoom with us? What is it like? What do you think of? What's the first thought you have when you hear that?
I'll go. For me, it was that in our culture, it's most likely to look as if you are crazy. So they'll use a word for it, non-acknowledgement. So that's what I grew up with, that is never mentioned. There are other ways to treat it.
Yeah, I think yeah, the same too for my community where I was raised as a young man. I'll see people talking to themselves sometimes. You'll see these people, they're just by themselves. Sometimes they're walking around. Sometimes some days they're clean, sometimes they're dirty, and they're kind of like neglected. They have this name. We call it Faith knows Mwandazimu. You are tagged a name and that is your name. So nobody calls you by name. They call you by a bad man, but in Swahili, which is so bad. I came to realize it was so bad. So, and was bad, but that was the days, because everybody was saying it. So I end up myself saying it because I was not pretty much educated to understand, what people can have mental health issues and there are ways that they can look for help. We were not like educated, or we had information. If somebody had resources, or somebody was going through mental health, and you see them in the village, you ran away. That was the only thing. Either you run away or you don't, or you just don't bother them. And there's this place used to be taken. I think it's called Madari. You know, that's the place we came to realize actually. So when I go to school, I'm like, oh, this is what they're taking. And we never know why they're taken there again. You know, I mean, it's like everybody mental health is just classified into one big box and just take them there, you know. So it was bad. I can tell you, I've learned a lot now.
You know, we are looking at, and Sam and talked to me about the culture. I'm American, Black American, and for me, how we just trivialize and or ignore when we have issues. I'm very open about me. I've been in institutions, psychiatric wards, when I was younger. A lot of drug use, being very uncomfortable. One of the stories I tell is that I was introduced to cocaine when I was, I don't know, in my 20s, which would be in the 60s, the 70s. And I became infatuated with it because it cleared up my mind. After years of using, I couldn't understand that, but once I had education and knowledge, I have ADHD. And I've been tested a few times in the last 10, 12 years. And so a couple of things were said to me by a Black psychologist. He says, when I was young, I was just a bad little black boy. That's how I was treated. And I remember when I was in junior high school, and it basically called middle school now, they were going to put me in a special room. And all the kids in the school called the jet class. No. Sorry about that. And I went home crying to my mother. I was about 12 or 13 years old. And the word we used then was retarded. And I said, I'm not retarded. I was highly upset. Well, what we would say today, I was traumatized by the system that wanted to put me in this room. And if my parents weren't who they were, in the sense of willing to stand up for me and challenge that, that would have impacted my life totally. Would have changed how, I mean, it impacted my life anyway, but being in that situation would probably made it worse for me. A lot of shame, guilt. Kids made fun of you when you're in those rooms. So we have to look at those things. And we still have children on IEPs, and we don't know. One of my sons, he had an IEP, and they told me he didn't read well. I said he reads on the computer quite well, good enough to read something, make it, build it, whatever. So we have to also look at how the system, and especially educational system, how it really defines our children and how they teach them or give them education, because they can be traumatized by that situation. But it is very hard when you say I have mental health issues or I feel, describe something like that. You don't want anybody to know, showing that you have a weakness. And so it's been difficult. The last one is resources. When looking for mental health treatment, you want to talk to someone who understands your specific experience and concerns. It can sometimes be difficult or time-consuming to find resources and treatment options that take into account specific cultural factors and needs. This basically saying, are you going to see somebody who looks like you and understands what it is to treat you as a person from a different culture, different ethnic group? And as if we don't know, mental health providers as a whole are in scarcity, not only in Minnesota or Minneapolis, St. Paul, but across the country. Now, then we're talking about providers of color, that's really a scarcity, because there's very few of us who hold mental health licenses in Minnesota and across the country. So resources can be very scarce if you don't know someone who actually is aware of where you can find some help. I work with another organization, and they called me the other day, and this young man's girlfriend called the number to this organization asking for help for her boyfriend. So if you don't have somebody watching out for you, or see that there's something going on that they can't understand and your behavior is changing, it could be very, very scarce in getting that help. It's we have a big problem with that, especially for people of color.
Hello, everyone. Thank you so much. You guys raised very important topics and factors that affecting our community, and how the culture looks like, and the trauma and stigma that we have as a society, and what we really need now is how we can teach our people and how we can deal with our kids, especially users. Often on time they don't want to share what they are up to, and usually they are on this social media thing, and every single person in the community always complaining about how kids are disconnected from the family, and they are wired with this cell phone with each other, but they don't want to talk to each other even, and they don't want to talk to the family. So I think it's a universal issue. However, this issue is getting worse, and kids are disconnected, and they are not doing good in school, and their behavior often change from one to different another behavior. So as a community, what we can do and where we should start, that is what we need to discuss, I think, and that is what I want to hear as a person who is really connected with the community of color here in Twin Cities. I had a chance to meet Somali communities. I had a chance to meet, of course, Ethiopian communities, Oromo communities, Mon communities. Uh, I have seen every single person, every parents are really worried, but nobody come out and say how we can address this problem. You guys come out and you guys have so courageous to call on us and bring this topic to the surface, which is very, very important. And I'd like to thank you. And we need to focus on where we should start and who can be our partner. To me, health professionals need to be a partner. Youth need to be a part of this. Parents need to be a part of this. Teachers need to be a part of this. This is how we can solve this problem. Of course, we need the resources. The government and institutions need to participate in these efforts so that we can be successful and bring up a successful citizen in this great nation. That's all I can say. Thank you so much.
Thank you. Yeah, I wanted. Sorry, go ahead.
No, you go ahead. I was going to ask you to answer the question.
Okay, I wanted to add something. You stated something on where we can start. Actually, there was a research paper that was talking about cultural beliefs and mental health. So there's something that we really don't talk a lot about, but there is that culture in Kenya where I grew up is when we talk about somebody with mental health issues, the first thing that people talk usually is the voodoo. That, yeah, they go into religion. That something happened, either a curse or, somebody did something. So they did a research on where, when we come here with these communities, where you can actually reach to people of minorities is in religious settings. Because what happened when they have a stressor, they lost someone, usually people regress to going to church and praying about it. Mm. They go to, the religious leaders to talk about things like that. They don't talk about it anywhere else. But when it comes to clinical, let's say of depression, anxiety, even bipolar, schizophrenia, sometimes if it's a clinical diagnosis, the religious side doesn't help with that. So the main conduct is, can we go back to where their beliefs is? Can we educate them more? And you cannot really, when you look at, another thing is we don't talk about it. We don't talk about it, but these people will come with some symptoms like Nate was talking about. It can actually just be high blood pressure, back pains, muscle aches. I can't sleep. And they come with those symptoms, and you will see it even with Hispanic too. And they come with those symptoms, they describe it that way, but really they don't understand it. They don't know there might be depression going on. So sometimes what I was going to say is, let's go into the religious, look at the religious aspect of it. How can we reach into them in religious setting? How can we educate those religious leaders to be able to also let them know, hey, there's help here. You're struggling with this addiction, there's help here. How can we have those resources, the number? With that, somebody can call and I can talk Swahili too. I can actually help in a crisis because we can communicate and they can relate and they can hear me. How can we have that channel going on? So that's all I had to say about that.
Well, and that's a good point.
For Faith, I have a question.
Mm-hmm.
Oh, go ahead.
No,
so
go
Faith
ahead.
had a question. I think you raised a very good question. When it comes to the issue of our faith and mental health, that's two different things. And so what will be the best way to navigate through it? Because like I said, even in our church, we speak more of a religious, spiritual part. That is where we are geared about spiritual part. So, but then you find the other part of the mental health that's neglected.
Yes.
I mean, people praying for you overnight. From your house. I mean, that part is neglected, and that's the biggest worry. So, how do you navigate that? How do we get our religious or faith leaders to come on board and learn more? There's the issue of mental health other than religious.
Education, through education. And when they do even theology, because I actually know someone who did theology, they also teach them how to differentiate. So they know when it comes to clinical settings, someone has gone through a loss or just had a baby and they have postpartum depression. There is that significant difference between someone who is just going through grief for a short and somebody who actually have the actual clinical diagnosis symptoms. So how do we reach out? I think we need to talk to the religious, those leaders. Most churches here, I've seen them embrace mental health. Like, if you talk to them about it, talk to kids about it, they listen. So we also need, that's how we can reach out to them. We also need to let them know, hey, struggling with this, we can have posters, just clipboard posted with their permission. So they know, hey, there's a place you can reach out. These are number you can call. These are resources that are available if anything is going on with this and this and this. So I think the main way is how can we reach them? But we know the only tool is to educate.
Thank you.
Yes. Can you hear me?
Yes.
I agree with it. At one time, I know I had heard of in this Somali community that a lot of the imams were, when they were talking, they started talking about people going to see mental health providers, stressing that they would do the prayers, come to the mosque and be prayed for 24 hours, but they also recommended that they connect with some mental health providers and they would have some names. And I think that's the education, as you say, Faith, is it is educating people about mental health. I'm one of those people, I don't, people have asked me to talk to people and they said, well, we're going to tell them you're a therapist. I said, don't tell them that. Because they might not talk to me or be as open. Just say you want them to talk to somebody. And I know Faith, you can ask questions to determine a diagnosis or at least something leaning towards a specific diagnosis. And that's what I try to do when I work with people, because I have worked with the Somali community, and I remember most of those people I saw at the time were elders. So it was, they had asked a lot of questions. They had not actually, like one woman said, well, coming to meet with you in a group is like, they said, we'd go sitting under the tree and we would talk, and I said, okay, and that's all right.
Mm-hmm.
I don't have to say, man, I got to put this ICD-10 code down. They want to feel safe. People want to feel safe and have a safe space to share how they feel. In reference to our kids, and I mean, it's about them feeling safe as well, but us listening as parents, non-judgmental. Because if kids feel you're judging them, they're not going to share with you. They're not, to me, in my experience, let me say that, in my experience. So being able to get them to feel safe with you as an adult to share, and as you see, I got a 5-year-old here, almost 5-year-old. So I tell them, if he wants to talk or something happens, just come to Papa. We talk about things happen, a mistake or an accident. Our reaction to what happens with them also impacts how they will trust us, even if they're your child. So, I know here, I live in St. Paul, and when we talk about the school system, especially people coming from Africa or East Africa or West Africa, is there someone that is working in that school system that one can begin to connect with? I know at St. Paul here at the Highland High School, I do believe that the principal or vice principal is a Somali brother, So if somebody sits down and say, how is it going? We want to connect to the community. Community wants to connect to you. Do you have some input? So we got to be able to open the door somewhere with the system, the community getting together and connecting and feeling safe so they can get some help and move forward.
Yeah, and you will see, even those who are coming, usually where you see them is you see them in churches. So can we have flyers in churches? Hey, you need help with these. This is the number to call. This is how you can reach out. Just those things that they know. I don't know where to start from. I came to America. I don't have no relatives because that's now where we go down here when it comes to immigrants and people that come here. They don't know where to start. They struggle with finances. They have language barriers. They just feel like they cannot connect. They don't know where resources are. So if there is a flyer where they start, usually the first place, where do I go to church? Hey, there's a flyer. This is the number you can call. We can talk. And if they can talk to someone, like say someone who they can relate, that will be very helpful. That will be really helpful.
Faith, I'm trying to develop a resources for mental health, but mainly based in Brooklyn Park. So the only problem is finding culturally specific. So mainly we tend to find resources is available for Hennepin County, Cube. There isn't that many specifically for culturally or culturally specific.
Okay.
So I'm trying to develop that.
How hard is it to get a hotline, like a crisis hotline with someone who speaks that language? Or how do y'all do that? Because I actually had someone call me. Somebody called somebody and said that he was suicidal. And then they didn't know what to do. And they called me. You know, what I just told them to call the 911 for police to do a welfare check. So, you know, we are new here. How do y'all do that? Navigate issues like that, Safia?
So Hennepin County, each county has a crisis line. There's Cube, I can send you all the information. And so they tend to call, and they have been in the last few years educated on different African communities or just immigrants. But we have to advocate for ourselves. So what we do is we usually, when they come over to my clinic or any other clinic, we have told them, hey, they're Somali, this is how you deal with them. So gradually they've understood the Somali culture, because more and more is happening in the Twin Cities. And that's because of the crisis. 10 years ago, they were not well educated. They will tell you that in the last 5 years, they have learned more about the Somali culture because of the crisis. You know, they've seen a rise in overdoses, addiction, and mental health crisis.
And also, just to jump in, Faith, you asked a very good question here. Actually, when you call the police number non-emergency, there's an emergency number, but you call and say non-emergency, and you ask for mental health resources. There is always a number that will give it to you. They have a backup number for that city. You know, then from that number, then they can be able to give you. When you call that number, then they can be able to give you kind of more different resources depending on your culture and depending what you're looking for.
Okay.
Yeah.
I'm not sure if, Nate, if you have more resources for somebody who is in crisis, depending on the culture, or do we just tend to call?
I'll say that you would call that non-emergency number, but also I agree with Faith. I think that even if you put out pamphlets that are both quote in English and or a cultural language, you know, Roma, Somali, you know, that people can. The other point she brought up is making sure that it's set up so that if somebody calls, they can get somebody to talk to, you know, because they do have crisis hotlines. And it varies on how people perceive those hotlines. But there's also, and I can't really say they don't have it in various languages, or at least a book Book of the Streets. Have any of you heard that?
Yes, I have.
Yeah, it's a book that has housing, all kind of information in it. And and like I said, I believe some of it is in other languages other than English. I'm almost sure of that. I haven't seen one lately, but being able to hand those out, having them places that people will come by and see them and use it. Handbook of the Streets. So, you know, a lot of it is, a lot of that has been focused at the homeless community, but it would work the same with people who are not homeless, but might be in a crisis situation or stressed about certain things at home. Give them that opportunity, especially if they're low income families.
Hey, Nate, you read on the resources. I think was last week on Friday. I was doing my outreach. I went to the city of Brooklyn Park. I mean the Hennepin Public Library, and I was amazed. There is actually a book of all the resources, housing, mental health. I think different languages they have come up with. So. And you don't have to come and ask. They'll tell you, hey, whatever you're looking for, they direct you to the book. You can go take that big book and you can look for all information that you want. Yeah. and it keep on changing. They keep on updating actually, because they have like a leaves. We'll put more information every time new information comes in. So I think our library is going to be a source of good information too. Yeah,
and that's good. But also, what we want to get it out in communities where we know,
yeah,
especially communities of color, especially immigrant communities. One of the things I think people, in my mind, looking at that kids are always under peer pressure, but in the last several years it has been very different because of COVID, no school days off like that, and what are young people's expectations, the expectations they're facing here in America is very different than what the parents thought it was going to be like. In my opinion, I have I have spoken with some Somalis and brothers, and they're like angry at their sons because they have gotten into this drugs and gangs sort of lifestyle. They had better expectations for them, but these kids are choosing to go another way, so they're disconnected. So us being able to work at helping them get reconnected to their families, and the families understanding the pressure that they're under, as well as their own parents is under pressure, trying to survive, work, be successful here in America. So there's a lot of pressure going on. And I can ask around. I work with another organization sometime, and they do what they call ARMS, and they work with a lot of East Africans in the community and provide certain services. So I can ask them what literature they have, and maybe we can get it out and have it reprinted, or find out where it's printed and get it out in the community.
Yeah, and then something else that I also noticed, when it comes, healthcare in America is expensive. We all know how expensive it is. So what holds people back usually is being able to afford, knowing that, hey, they can go somewhere and apply for insurance, things like that. So how can we help these people to be aware that you just don't hold back? You can get resources on that. Somebody can help you on how to apply for insurance. Where, when it comes to substance abuse, we know that's expensive. They cannot just afford to go into an inpatient unit for substance abuse. So they struggle with it. They feel like they're trapped. So how can we get to those people and let them know, hey, you can get help. You can get resources. You can utilize it. You can get help with that.
Well, back to the point of connecting with those organizations that actually serve a lot of, like I said, people development services is located both in Minneapolis and St. Paul. And like I said, their communities that they've been dealing, they've been dealing with is the East African community, both Somali and Roma. They also deal with the Karen community. I think that's how you pronounce it. They're from Tibet. I believe that's where they're from. Don't count my word. So they do deal with cultures of people of color and what we would call immigrant communities. So connecting with those kind of organizations, and if nothing else, getting information that you can give to the people that you see and you would like to see, where you can hand it out at churches, mosques, those places, because where I live here in St. Paul, there's a large East African community right around the corner, and it's interesting. I was on what they call the Highland Park District Council, and we did not get a lot of interaction with the community. So you really have to go in the community and reach out to them. So it wants to draw them out, reach out to them. You're not asking for nothing, you're giving something. You know what I mean?
Yeah.
I mean, look, I'm not asking that. I want to give you something, that might help you.
They might need, initiatives for them to be able to receive the information. What we've noticed works is just by giving small information, and then afterwards they tend to the first thing they ask is, where can I get resources that speaks my language, that look like me, rather than just going to the mainstream. I think they've had lots of problems with mainstream.
True.
And then we have a question from Gima. He said, it's excellent information, but how can we get more funding and reach our communities so that people will stop the circle of personal and cultural embarrassment? Faith, would you be able to answer that question?
Maybe not, but it depends with what you're looking for. Are you looking for funding to run a nonprofit to help, or are you looking for the government? Because the government for sure have put a lot of money into, we do have resources from the government to help with all these things. It's just a matter of what people get in touch with it. Just a matter of them being able to utilize it and use it to get the help they need. So I think with that, I don't know if I answered it right, but I think it depends what you're looking for.
I think I can
I don't
just
know if you
jump in.
Yeah.
I can jump in. I can say resources are there. Resources are there. You just need to sometimes, like I think there's a group called NEMA. Sometimes you have to look at the if you go to the Brooklyn Park sometimes website, sometimes they send this all the information here, and then the only thing you do, you have to go and apply. But then there's some certain criteria. I think you have to be like a non-profit, or you have to be like a faith community. You have to apply. Then there's guidelines. They need the information how you're going to target. But the issue is sometimes, to me, sometimes it's not even the funding, because this program actually, this grant sponsored this program. And believe me, we have gone out in the community. We have done outreach, me and Sophia. I think last weekend, I think we were, last 2 weeks ago, we were out in the cold, talking to people and spread that information out there. And basically, the community that we were, actually, you can tell these people that are going through some personal issues. I mean, there's issue of mental health, because all of a sudden they're nice, they are shouting, they look like they want to fight again. Then all of a sudden they are quiet. So a lot of going on because of what's going on in that community. So sometimes it's just people. So me, even her, we have come up with the idea. Maybe it's not. Maybe we go to these people where they are. We'll try, maybe go to where they are, maybe where we can be able to find them, maybe if it's a local church, maybe in the afternoon, talk to the pastors, maybe can even go for an hour, It's a huge apartment complex, maybe go to them, have an event, talk to the managers, and maybe we can give them the flyers so they can come to us, other than calling them on Zoom, or maybe let them come to our office, or come to our community center, because of transportation issues. So we have learned a lot. If we then, so Mr. Graham, want to say, it's when you even getting this funding, it's just how you have to strategize and how to get these people, and how you have to explain how you're going to utilize that funding to get people to come in. And you learn through steps for you to become wise, and reach these people to where they are. They will not wait for them to come here. A time has come for us. We change, we become strategized, and we go to their space, to where they're more comfortable to them.
And I would add one more thing. It's you can have a problem, that you need help, but that doesn't mean that you will ask for the help until it might be in a crisis moment. What I've learned from this is it would take more than somebody just to come around and to say, hey, we can help you, or we can educate you on mental health issues, or going through different stages of mental health. People have been let down so many times that they're not sure if they want to ask for help anymore. So that's one of the things I've learned, that challenges are, just because you need help doesn't mean that you go and seek treatment.
That's true.
My personal recommendation as of now, we have, as you guys mentioned, we have different organizations who can help the communities in their language. That's one thing. But the problem is the community doesn't know how they can access those kind of resources. That's a problem. So such kind of discussion is very important. Bringing different individuals from a different community, this can bring us together. So this is a wonderful beginning, honestly speaking. So keep it up what you guys are doing. My observation, whether it's in Somali or Oromo or Ethiopian or other East African communities, from my observation, if you guys are able to connect with, like, churches, mosques, and you guys show up there and they try to educate people, even if the first thing is problem identification. You guys identified that there is an issue in East African communities about mental disorder. When we say that one, it is a kind of very broad, honestly speaking. It's a mental health issue. There is a kind of called stress. There is a kind of anxiety. There is depression. There are many more. Having all that kind of thing is even let our people speak out any kind of issues they have. Once they're able to speak out and they try to identify as they have their level of their mental issue, finding the solution is the second part. So in order to wrap up what I'm saying, to make very short, reaching through mosques, churches, whether that belongs to Oromos or other Ethiopians or like Somali or Kenyans, just reaching the religious leaders is very important. Pastors, sheikhs, imams, those are very important. One. The second one, reaching the community leaders. To create such kind of awareness. There are other issues we are mentioning as a community. Here, most of the time, I know you guys may understand that you guys have seen that there is a protest taking place in this country, right? In Minnesota, whenever we do some kind of protest, our community members, they issue back home like human rights violations, a kind of killing, a kind of something, displacement. All these things matters, individuals who are living here. So, I mean, some concerned individuals should pay attention to that one, because we have seen the life of our mothers, our sisters here, and back home at the same time, they have been suffering. By default, those people can expose for mental health. So this is what I can say. Thank you very much. I don't want to take more time, but having this kind of discussion in the future continuously is very important. Thank you very much.
Well, Sam, you mentioned something about an event. I think that those are the kind of things, if you, like you talk, going into a community and having an event, offering, I don't know, some services, minimal services to get people's attention to talk to. And what the gentleman is saying, I hear is, what is anybody really listening to those communities? I give an example. I used to be the director of what they call a family resource center. And I was in a community that I was quite familiar with. So there was an issue. It was based in a school, but there was an issue. And when I was talking to the community, the mothers and stuff, I said, well, go downtown. One of the things is you go downtown and talk to the superintendent. And they looked at me and said, no, we're not doing that. You do it. I said, no, I work for the system. It wouldn't do me any good. But the point is, what happened was, they said to me at that time, they said, we need jobs. And I said, what? We need jobs. And it was the early 90s. And so I helped set up a school-based CNA training program. They didn't want to go talk to the superintendent about nothing. This is what we need. So what I'm saying, and I hear him saying, hearing what the community needs and being able to say, if nothing else, this is how we can help you do X things. Offer an event. I think all people are humans about the same. Having some food, having some minimal services there, how they can talk to you. Sophia mentioned Faith mentioned people getting insurance. There are navigators throughout this, Minnesota. I mean, as a social worker, believe me, Minnesota is a lot better than a lot of places. Well, they got their social service system is quite good, but you still have to work through and navigate through what's going on. Who do you really talk to? Where is it better for you to go as opposed to going to another area and you get to run around? Because that happens. There's no denying that. But being able to get people to listen to them and getting them connected or helping them get connected. An event that you could have at a church, you know, that you bring them some kind of services and information to help them connect. Of course, you might want to bring some food. That's a good attractor. You know, community meeting. We're serving whatever, you know, depending on the community. You know, we know we're not going into a Muslim community and serve ham, but you know, what can we do? Just to talk, a couple of hours, you know, whatever. I mean, you gotta, it's outreach, you know, because when I hear somebody saying that they're not getting connected, that hurts because, like I said, Minnesota is pretty hefty on the social services and they got a lot of money. I'm telling you, I know they got a lot of money because I talked to them. They got a lot of money, but everybody doesn't get a piece of that money. And the American Rescue thing was a part of it. And money is an issue. I mean, money isn't the main focus. It's really how can we help people help themselves and get situated and feel safe.
I agree with you. We do have resources. And when you talk about, because what's the community health clinic that I work with, we do have a couple of community health workers that do the navigating. So patients come, you identify their needs, and then from then they help with applications, you know, Medicaid, Medicare, housing, if they need any. And then they pick up from there. But then you don't forget, when it comes to medical issues with these patients, we also cannot just ignore that side because usually mental health issues and medical issues kind of tend to go hand by hand. So we do follow-ups. They also do follow-ups. They go to a hospital, they get discharged. Maybe in a month, check on that patient, that person, see how they're doing. We just can't start and then we forget. We assume they're okay. So we can keep it. And then that we can grow. You grow that community because they tell each other, you know, it spreads faster.
In my experience, although that we have so much resources available, it can take a while to get the help. So, for example, Hennepin County Family Support, they have a large waiting list. So patients are waiting 3 to 4 months to be able to get access. It just, the resources is there. It's just that the demand is way higher than anything.
So now that we go back to the funding, how can you develop your own little, you know, that section that can actually address only that population that you're targeting?
One of the ways I've seen like Hennepin County is doing, and maybe different cities like Brooklyn Park, they are targeting nonprofits who are doing the work in that city. They train you and they tell you like, hey, you know, Global, you are in Brooklyn Park. Also, maybe you wanna look for somebody who are more of experience. They can be able to get resources. So we can go with Talo Care, and Talo Care can be able to work together, the joint program whereby we can go and get this and get the resources. So that they can flow back to the community. And again, if you look at the Hennepin County, they're changing the way they are hiring people. You know, I mean, they are looking for people who look like me. They're more more likely to know the different communities. I can be able to go and work with them. I can be able to give them the resources here, other than maybe a person from Russia who's sent to maybe to a Somali community who does not speak the language, or maybe who will have a different, you'll struggle to navigate through in the community. You know, be asking a lot of questions here. There'll be language barriers. So I've seen that changing when I go out for outreach, and they're getting people, even young people or qualified with skills, being given a certain portion outreach to go out and face that community. I had one person, a lady, came actually to my office, I think it was about 2 months ago, and she introduced herself. She said, you know what, I work for Hennepin County, I'm doing outreach. I have come to meet all these organizations, and this is what I do, and reach out. Can you also let me know if you can have another meeting in the future, like a town hall meeting? So they're doing something different for now, kind of just going to the ground there.
Okay, so my question is, if we and I want to go with you and Sophia, next time you all go out, just let me know.
Definitely.
Sure. So when another way is when we do, if they let's say the meetings in the office and all that can help. When there's a group, also you can do invitations from those organizations, let's say the Human Health Services, to come and educate, to come and let people know. So at least they can also know, hey, I can talk to someone. There's a place I can give this. Just a welcome, so that they can give speeches, educate the community.
Yeah, and it's a good question too, because in the nonprofit world, you can never survive alone. You have to work with other organizations here. You have to navigate together for you to get that resources. And because if you are dealing with mental health, so right now, when you go out with Sophia for outreach, we carry other resources here. For example, we can have information for nurses who are looking for grants to go for school. For example, you can look for housing. For example, you can look for SNAP information here for young girls who have got kids and they're struggling. Or we can have information from Atlas staffing. We carry that information for young men who are looking for work, and they're kind of struggling, So I think so, and that's been the core. When we had a breakfast meeting here, we have the same thing too. We try to invite people from different organizations here, and we allow that. Yeah, we have a big board whereby whenever you come in, please bring your resources, so that when you go out or somebody comes to our office, they can sit down as you wait and pick up more resources here. So and that one is filtered and goes out to the community. We had a lady who came from Texas, I think it was last weekend, and she was really struggling. A lady with 3 kids, she's looking for diapers, she's looking for food, she's looking for clothes, 3 kids. And actually when she came to the office here, we had so much resources for her that she couldn't even believe it. There was an organization which they paid for her rent for 1 month, then plus all these diapers and food and everything. So she's planning, she's navigating through now to go to work by having somebody give her a ride, but she feels that her weight is better than before, because she was so stressed when she came to my office here, because she's from my country, she was able to confide to me. And so I think having those other resources and kind of sharing with the communities out there, I think it really helps when somebody comes. You kind of have all this information with you, so you can be able to figure it out. And if they get stuck, I take them there with our van, or my vehicle, because we want these people to be able to feel free. You don't want to leave them stuck. Then then they're confused. They don't know where to go. So kind of start a journey for them. Then from there on, they're able to pick up the pace.
I think, Hassan, I see your question there, and I think I can answer that. If you have worked, that's just how the system works. You have to have a goal, you have to have an aim, you have to have an objective, you have to have the target population and what you need to do.
Yeah.
So we were talking about funding. Funding is not an issue. But now, what do you want to do?
Yeah.
You have to have that in place for you to be able to get the funding to help you achieve that. So we talked about that nonprofit organizations. You want to, start somewhere there. If that's your goal, this is a population. Then you apply. It's a process. Apply for funding, and then that's where we move on when it comes to financial. I think that's just how the system works. They just can't give you the money if you cannot prove what is it for.
Well, you know, I want to slightly disagree.
It's okay.
No, but I mean, you have a good point.
Correct me.
You know,
May I respond for this?
The funding is important. The networking is important to connect with other organizations. The nonprofit world can be territorial, you know.
My focus is not only funding, but
Go ahead. Okay. Well, I think if, you know, I'm thinking about what would be an action plan for just this group of people talking, speaking, sharing their ideas. And this, of course, we know this organization is represented here. I would look at this, to me, that is just this group of people being able to say, how do we connect to the other organizations? And just to say, here we are, this is what we're looking for. Then finding out, is there more funding to be a facilitator? I don't know, someone might provide, just heard Sam said he provided some support to a person, a family. I don't know if Sam does that every day, you know? If he does, that'd be good. How do we help Sam get some more items to give people to help them move through the system? Or, you know, how can we come together to do that? You know, it is, what's the word? Somebody was talking in the sustainability. I was reading some message there, looking at how do we make this this action and helping people sustainable, always there for people to access.
I agree with Gima in the sense that for us to be able to do this in the long term, what the communities have experienced in the past is it's usually a donation comes in and then another one comes in and they just, you know, been disappointed throughout these many years that different firms or organizations have come and said, we are here for you. They've had more disappointments rather than gains or good experiences. So what I intend to do is in the long run, get more support where we can, you know, help our community. Just because you're going through mental health doesn't mean that, you know, you have housing issues. There are many other issues. And what I've learned from when we went to the outreach with Sam is the first thing they say to you, well, I need a job. Do you have, you know, can you connect me with somebody who can offer me jobs rather than just discuss mental health? So having other resources available rather than just education on mental health, you know, when you're going through so much, you want stability, you want to be able to have a roof under your head, you know, so you can address other issues mentally, physically, and to be able to have that rest.
And lastly, for me, Mr. Grima, what Sophia has said, it's very important to establish a relationship with your customers. You know, the people that we go to see every day. We have been doing this, I don't know for how long, Sophia. You know, the first time was hard. You know, it's people even confiding to you because they don't know you. You know, their fear. You know, they have to trust you. Then again, we have to go through the owners of the building too. They have to do like a due diligence checks on us. You know, are you people legit? Are you gonna come today? Are you coming next week? Then are you gonna leave? You know, then again, what's your program again? They'd like to see like your program. How do you plan to do it on a long term? What time are you gonna come in? Like if you go on a Saturday, if you go on a Thursday, can we trust you with the key? Because again, they're about safety again. So building relationship is very important because you have to be seen there, and that's when people will come acquainted to you and they'll start appreciating you, and slowly actually when you go out and tell whatever grant you're looking for and you say, you know what, you can be able to do this, they can be able to check your record, or they can confirm with this community that you really need help. They need help, and they can give you support. So it's a time consuming, but just you have to think about long run again.
Yeah. Can you? Okay. You say okay. Let's say a system that's already It's already non-profit started running. So I think his concern is we have the people, we can reach to people, but we need a long-term goal. So I think his question, if I'm correct, is the grants. How do you get the grants? Where do you specifically get that
Okay,
to keep it going?
that's a good question. So, number one, you have to be very
I
proactive.
think,
You have to be number.
So
Mr. Saab, Mr. Saab, thank you so much. I think my sister just nailed down what I was trying to say.
No.
However, you know, I feel like this is kind of brainstorming meetings, and so that we can justify our journey and allocate or decide where we should go. And that is my understanding from last meeting. I think I missed one of the meeting last time, and we are not inventing the wheel. It is right there. And I personally, as a person who is sitting with you guys here, I want to know my role. What I what is my input? For how long? I, as a community member, maybe as active community member, I care about my community. I have seen there is a challenge. I have seen there is a need to be done. To do all those kind of things, we need some funds. If you guys know some funds, I want to know that so that I can apply for my community, in particular, just Oromo community of Minnesota. If not, what is my role to sit with you guys here for hours and discussing the same question, the same issue again and again. I'd like to be very frank to you guys, and I want to help my community, but I want to know how. And I need a partners. I need those people who know how. That is why I came to these meetings. We have health experts in the community, and we can hire them. Even we have psychiatrists, psychologists in the community. We have registered nurse in the community, and even we need to recruit some very important influential people from the community so that we can be successfully execute this mission. If not, we're talking doesn't make any difference. And I'm sorry that I'm not offending anyone here, but that is how I feel about it.
Gima, we need to set another appointment just with us and other partners who would like to contribute. And that's a very good point, because we need funding consistently rather than just short term. So we have to have a strategy where we are constantly looking for grants available, and not just the federal, but also corporation sponsorship.
Yeah, the money is not always my goal. Now there is a problem that we experiencing as a community that we see every single day. I am with this community every single day. Okay, you can call me a community leader. However, I'm a good active community member. That's how I call myself. I really worried about youth. Youth are disconnected. How we can get enough service, enough education, enough counseling for our youth so that they can be a good, successful citizen in this great nation. If not, talking is not, my thing. I would like to do something. And I've been with you guys for maybe 2-3 times. I feel like I'm wasting my time if I don't know where I'm going. That's my concern. Thank you.
I'll speak to you after this session, Gima. I'll email you and call you, okay?
Thank you, ma'am.
No problem. I'll speak to you about this.
Can I say something real quick?
Go ahead. Sorry.
Yeah, and I see where you're coming from, and I can see your vision, because you want a more impact. You want a bigger. You want bigger than this, but because I've seen just a nonprofit start this way, reach out to the community, grow, because the more you grow, the more funding you get. They see the impact. And then ended up opening an outpatient clinic. They acquired a building, opened an outpatient clinic, whereby they can actually have session classes. They can hire psychiatrists, they can hire counselors, they can hire social workers, and they can actually do more. So I see your long-term goal, I do. But now the question is, how do we need to get to work? Like you said, we need to roll the wheel. But
Yeah, as a community, like maybe 4 or 5 months ago, we lost very brilliant young men. And, after that, we had a series of meetings, and we understand, we as adults, as a parent, we have been totally disconnected from our kids. And it was an aha moment for my community. And a lot of people need this service. I know that.
And Gima, there is lots of resources available, but only if you live certain Minneapolis or St. Paul. What you've noticed and what others have noticed is other services available in the suburbs, for example, Brooklyn Park, Brooklyn Center, different areas up north or different in the suburbs. So what can we, in the long run, do more? And I'll speak to you afterwards. And then I would like Nate, Faith, and Sam just to wrap up. If what your thoughts are going forward.
My thoughts are, like I said, the initial, what can we do? I mean, the conversation is great. This is what I feel y'all wanted. This is what's needed, but what can we do? I was thinking about something that what I would call a spiritual guide or coach, metanoia, which when you come together to agree on doing something, that's all one needs. Now, people might say, what does that mean? You still need money, but you don't focus on that. You focus on what you're going to do. You reach out. This is spiritual. There's my last religion, and I don't practice much, was Islam. I learned a lot of things there. And my thing is always about doing good work. Always about working at doing some good work. And I think that as a group, one of my ideas is for y'all to, and especially with Sophie and Sam, reach out to the organizations. Let's make some inroads to organizations that are doing things and get there and present, bring this group of people together that would sitting right here and say, hey, this is what's going on. Because I know there's money out there. You just need to be able to talk to the people that have it. But that's not the point. The real point is to reach out to people and say, we're here. We're here. So, and being able to say what we can do and are willing to do to move them forward. And one of the things that we must look at, I got to be careful, is sustainability of your groups, of your people. Because to be very honest, I'm born and raised here. I know who the first slave was that started my mama's side of the family, first slave. And that you can believe me, the system is headed back. I'm 72 years old. I've been to backdoor restaurants, colored only toilets, etc. The system is headed backwards. And they don't mind taking everybody, child, family, right along there. So we got to work together to get our people to understand about mental health, about trauma, I was telling Sophie that my man said to me, when I say, just like I said, mental health, what does that mean to you? When I say trauma, what does it mean to a Kenyan? What does it mean to a Somali? What does it mean to an Ethiopian or Roma? It may not be the same when I say something and how I deal with it, you know, and reaching out and connecting. And how can we help different people move forward? What do we have? If it's just information, that's good. Can we get some money? That's better. But we're gonna make sure these people are connected to people who want to help them and will help them. You know, some kind of action plan. Not a big one, but you know, piece by piece. That's mine. Sam?
I think having these conversations actually it has really helped us a lot. This is our first actually partnership with Sophia. And I can't lie to you. It's a challenge even having this grant because it's a very specific place whereby you have to do it. So on the reporting also it's kind of very specific. So we are learning a lot. And hopefully, maybe as you navigate through, we can be able to think big and maybe accommodate and be intentional in what we do. But it's just that you are tied a little bit because it's what the city wants, but not what me and Sophia we're gonna do for now. But like I said, we are gaining experience. We are moving up. We have tried now. We are reaching out to communities. You know, we are reaching out to a few pastors in the community. I think we'll be doing after mental discussion, maybe on a Saturday or maybe afternoon. We have a big apartments now. We'll be able to have like classes there on the spot, but it must be just again within a specific zip code within a certain community again. So we're getting experience. We are moving, but we're learning a lot. So I think this is for you now.
He's seen.
It's a learning curve and it's a small project at the moment, but to think big, or we need help, we need others to come along with us so we can get our message across broadly. And this grant is only available for now for Brooklyn Park. However, if the city sees that it has an impact within Brooklyn Park, there are other opportunities available. But what we need to do focus on now is getting this correctly. Once we have figured out how to do this ground and understand what needs to be impacted, we can get others. I don't want, to spread myself too thin. I need my community to also to help us to able to reach our target. So it might mean me reaching other communities, asking, for example, Oroma and diaspora media to help out. I am trying at the moment to reach others within Brooklyn Park so the message can be getting across. But that doesn't stop me looking for other partnership and to be able to continue this in the future, not just for the next 9 months or the next 6 months. I want to be able to do this forever. So I need to be able to have partnership on the ground to be able to do this together.
Wait, say something.
I just agree with everything that you're saying. It's not easy. It's not, and you just have to remember one thing. We have to start somewhere.
Yeah.
I know, we have a bigger picture, but we have to start somewhere and get it right. It's just how the system works. And I know we all do have hearts to help, but we have to start somewhere. So we are with you. We are together, all of us. I know for sure. And that's what I said. If I have to change my schedule and do something, I will definitely be there.
Okay. Thank you.
Yeah.
We appreciate for that. Yeah. Thank you so much, everybody. We're so much grateful, even for your all ideas. This was one of the workshops that is very, very much engaging. Personally myself, I think I'm learning a lot. I'm gonna take this information and put some more information. I sent to I have some fatherhood groups. I gave ideas to see what's going on. So I want to say thank you again, Nate. Faith, thank you. Oromo Diaspora, thank you for partnering with us, and Sophia and Agrima and our Brooklyn Park team. Thank you so much.
Thank you.
We'll see you another time, and you stay safe and educate somebody about mental health. Thank you.
Thank you, everybody.
Thank you.